Anatomy 32, Chapter 23, the Respiratory System. Topics, Trachea and Bronchial Tree. So the trachea is inferior to the larynx. It is anterior to the esophagus. It's located in the cervical area, aka in the neck and throat, as well as in the mediastinum of the thoracic cavity. So partially in the neck, partially in the thoracic cavity. Its functions include conducting air between the larynx and the main bronchi, and also filtering and warming the air. So it does have a mucous membrane that's able to remove particulates from the air and also moisten and warm the air. The trachea has 4 layers of tissue. As you can see here, it's also close to the thyroid gland. So again, here's the trachea, here's the esophagus, here's lobes of the thyroid gland. The first layer of tissue, the deepest layer, is the mucosa. So the mucosa lines the inside of the trachea, is adjacent to the lumen or open space within the trachea. And of course, the trachea should always be open and filled with air. The mucosa is lined with ciliated pseudostratified columnar epithelial cells and also goblet cells. The goblet cells producing the mucus of the mucous membrane, the ciliated pseudostratified columnar epithelial cells possessing the cilia that is able to beat and move the mucus toward the larynx and pharynx. The second layer, the next one out, is the submucosa. Submucosa is composed primarily of areolar connective tissues and also has some glands embedded within it, some of those glands producing more mucus. Out from that is the fibromusculocartilaginous layer. Whew, that's a mouthful. The fibromusculocartilaginous layer includes the smooth muscle tissue and elastic cartilage that is adjacent to the esophagus, and that is able to alter the diameter of the trachea a little bit. And then this larger C-shaped piece of hyaline cartilage that helps keep the trachea open at all times. So again, fibromusculo referring to the muscular portion, cartilaginous referring to the cartilaginous ring. That makes up this layer. And then the fourth layer, the most superficial layer, is the adventitia. The adventitia is made up of areolar connective tissue and defines the outer surface of the trachea and is obviously a place where blood vessels and nerves can run along the trachea before entering it. Tracheotomy. Tracheotomy is an incision in the trachea that is occurring below the cricoid cartilage. So the incision needs to be completely and solely within the trachea. And it is used in extreme situations in order to bypass persistent obstructions, to allow there to still be airflow to and from the lungs, even though there's some sort of blockage in the superior portion of the trachea or in the larynx. This then brings us to the bronchi, or bronchial tree. The function of the bronchial tree is to conduct air between the trachea and the structures of the respiratory zone deep in the lung tissue. And it also allows for some filtering, warming, moistening of the air because the bronchi are lined with a mucous membrane, which of course produces mucus that can filter out some particulates and cilia that can then move the mucus toward the trachea and then further up. So the bronchial tree initially starts with the right and left main bronchi. So the trachea within the mediastinum will then split with a left main bronchus and a right main bronchus. The main bronchus will then further split into the lobar bronchi. And then the lobar bronchi will further split into these even smaller segmental bronchi. Segmental bronchi will continue to split into smaller bronchi, eventually becoming microscopic bronchioles, and then leading to the terminal bronchioles, so going from bigger tubes to smaller tubes. So the bronchi are structurally similar to the trachea. So they have the same 4 layers of tissue as the trachea possesses. However, the bronchi do have structural changes that occur as they become smaller and smaller. So the mucosa layer, initially up through the segmental bronchi, the mucosa layer is lined with ciliated pseudostratified columnar epithelium, just like the trachea. However, as the bronchi get smaller and smaller, they go from being ciliated pseudostratified columnar epithelium to ciliated simple columnar epithelium to eventually, within the bronchioles, ciliated cuboidal bronchioles, epithelial tissue. So again, going from being columns to down to just cubes, and then eventually non-ciliated simple cuboidal epithelium in the terminal bronchioles. So eventually we get to the point where there's no cilia either. The submucosa is basically the same, and then the fibromusculo-cartilaginous layer changes. The main bronchi, structurally very similar to the trachea with those C-shaped cartilaginous rings keeping it open. The lobar bronchi have less cartilage tissue, so instead of C-shaped cartilaginous rings, it is more like plates of cartilage. The segmental bronchi and on, as the tubes get smaller, there is less and less cartilage. So basically, as the bronchi become smaller and smaller structures, there is less and less cartilage until eventually in the bronchioles, there is no cartilage at all. Also within the fibromusculocartilaginous layer, as the amount of cartilage decreases, the relative amount of smooth muscle tissue increases. There has to be something forming this layer of tissue, and so over time it becomes smooth muscle tissue until eventually in the terminal bronchioles there's only smooth muscle tissue and no cartilage. Asthma attack. Asthma attack is a bronchial disorder. Basically, a few different things happen. One is the smooth muscle tissue in the bronchioles go into spasm and contract abnormally, reducing the airspace within the bronchioles. And because there is no cartilage to keep that open, you can even have the bronchioles completely close because of these spasms. In addition, there is often inflammation that develops within the bronchioles as well as excessive mucus production. So swelling of the bronchioles as well as the contractions and the increased mucus production will basically reduce the lumen size, making it very difficult for air to pass in and out, and can even completely close. That is it for this part of the lecture.